Hi, I'm Dr. Danny Shaban with Dominion Women's Health. I'm a board-certified OBGYN and laparoscopic surgeon. I'm based here in Richmond. I'm the Director of Robotic Surgery for Intuitive Surgical's Epicenter, as well as the Director of Robotic Surgery for Richmond's training facility. What we're going to do this evening is go over some changes in your body, to discuss illnesses, chronic conditions affecting you, your family, and your friends, as well as answer some common questions related to uterine bleeding. Some common conditions such as benign health issues are gynecological, urologic, cancers, menopause, osteoporosis, overweight, and obesity. We're going to go over a little bit of the anatomy of the uterus and reproductive organs. And this is an illustration of the uterus. And that's in basic terms, just talking about the womb and the endometrium and the myometrium. Look at the fallopian tubes, the ovaries, which are the ones that are releasing the eggs for pregnancy, the cervix opening through the vaginal canal. Some elements of your annual exam when you go to your physician for your yearly exams are the exam itself and history. Some of the diagnostic tools that we have are your pap smear, HPV testing, and genetic testing. Your pelvic exam is very important to see if the uterus is enlarged, if there's any masses or vaginal discharge. One of the other things that we can use is a transvaginal ultrasound as well as blood test. If you have symptoms or risk factors, ask your doctor about additional testing such as ultrasound, MRI, X-rays, CT scan, a hysterosalpingogram in which water is inserted through the cervical canal and an ultrasound is done to view the cavity of the uterus, laparoscopy, hysteroscopy. Note that all these things that are done will not apply to every condition that a patient may have. Going over the menstruation. A menstruation is a woman's monthly bleeding or period. When you menstruate, your body sheds a lining off of your uterus. The period comes regularly. This is called a menstrual cycle. The menstrual cycle provides an important body chemicals called hormones to keep you healthy. The menstrual cycle usually averages around 28 days. Your period may not be the same every month. It may also be different from other women's periods. Looking at an overview of the menstrual cycle, where we look at pelvic pain related to the menstrual cycle. Normal menstrual cycle, a woman might have mild pain before or during her period. What's not normal is to have extreme pain that interferes with your quality of life or even your work. When we look at bleeding, normal, a woman will have her menstrual cycle where she'll bleed 4 to 6 days once a month. Now, this can average in the amount of blood flow each month. What's not normal is a period that routinely lasts longer than 6 days, causes you to change a pad or tampon every hour, and you have regular breakthrough bleeding during that menstrual cycle. Painful intercourse. Normally, a woman should never have pain during normal intercourse. Pain during intercourse may be related to issues with bleeding or issues with the uterus or ovaries. Back pain. Mild back pain, cramps before or during your period is normal. Intense or not remedied with over-the-counter medication is not normal. Chronic headaches. Some women, because of the progesterone withdrawal or estrogen withdrawal, depending on which, might have mild headaches for 1 or 2 days around their period time. Severe or headaches lasting longer than 1 day, not relieved with over-the-counter medication, is not normal. Infertility. Normally, women trying to conceive will conceive within the first year of trying. What's not normal is if they have not conceived within 1 year of unprotected well-timed intercourse, or unable to carry to term. What are some of the common causes of abnormal bleeding? We look at hormonal imbalances. It could be uterine fibroids. It could even be medication that you're taking, inherited bleeding disorders, or all the above. All the above. A quick fact, heavy bleeding is one of the most common problems women report to their doctors. It affects more than 10 million American women each year. Some of these causes for abnormal uterine bleeding, one of them that we'll go over right now is hormonal imbalance. Your menstrual cycle is controlled by hormones, including estrogen and progesterone. When they're out of balance, these same hormones can cause heavy periods or bleeding between periods. We even have women that may not even have a period sometimes when these hormones are out of balance. Causes of this imbalance may include changes in women nearing menopause, diabetes, thyroid disease, or other medical problems. Obesity or anorexia can both work in this effect. Stress can cause bleeding abnormalities, and of course, strenuous exercise. Looking at uterine growths, when we look at fibroids, they can be growing within the muscle of the uterus, within the cavity of the uterus, causing abnormal bleeding. You can even have polyps. Adenomyosis is something that causes heavy and painful bleeding, and that's where the glands in the uterine muscle are dilated. Hyperplasia is when you have a lot of these glands within the muscle of the uterus. And then last but not least is endometrial cancer. What are some of the risk factors that can cause this bleeding? Adolescent girls who've recently started their menstrual cycle are especially prone to ovulation disorders in the first year to year and a half of their cycle, can have bleeding issues where the bleeding can be prolonged, or sometimes they can even skip a cycle. Older women approaching menopause. Women the ages of 40 to 50 are at increased risk of hormonal changes that lead to menstrual cycles without ovulation. What are some of the symptoms of abnormal uterine bleeding? Bleeding or spotting between periods, menstrual periods less than 28 days or greater than 35 days. The time between the menstrual period changes each cycle. Women may complain of bleeding is noted to be heavier over the past several months or year, and bleeding that lasts more than or greater than 7 days. Abnormal bleeding can have many causes. Your doctor may start checking these causes that are most common to your age group. Excessive menstrual bleeding. Some of the treatments and surgical options that we look at are hormonal therapy, beginning with birth control pills. Some of these pills are progesterone only. We also can use intrauterine devices that have progesterone within them. And then looking at bioidentical hormones. When we look at surgical approaches, such as abdominal versus minimally invasive, we can look at endometrial ablation. And with that, we burn the lining of the uterus so that it doesn't shed each month and have these heavy periods. Hysterectomy, resection of endometriosis could be another option, or removal of fibroids, which is called myomectomy. Hysterectomy is the second most common surgical procedure for women in the United States. Approximately 1/3 of women in the United States have a hysterectomy by age 60. And this is just a little cartoon showing your hormones are out of balance. We need to get them over to the other side. So some of the hormonal changes that we see with age, if we look at hormones build tissue and improve your immunity, decline within 50 to 80% by age 50. And these are some of the hormones that we're looking at: DHEA, testosterone, growth hormone. Also, progesterone starts to decline at around age 30, and your estrogen, the estradiol, disappears at around age 50, quote, menopause. Thyroid hormone production and sensitivity declines And this is where you see women over 40 are more susceptible to hypothyroidism. And we look at insulin output as it declines. You get risk factors for diabetes. By age 50, you've got approximately 20 years of hormonal deficiency. So looking back at it, at around 30 to 35, your hormones are gradually starting to drop. And this is a quick graph just looking at your progesterone dominance in a normal menstrual cycle. And as you notice, where ovulation around day 12 to 14, your progesterone tends to peak up and then it drops back down at day 28. And that progesterone drop will cause your cycle to kick in. And we call that a progesterone withdrawal. If you look at the other graph below it, that's your estrogen, just stays consistent. Then what we do is we look at perimenopause. And when we talk about perimenopause, the best way to describe it is your ovaries are trying to decide, are you going to be a 30-year-old or are you going to be a 50-year-old? So they're not working at full capability. So if you notice the progesterone graph, how there's a significant drop in the progesterone. The estrogen is a little lower, but still around the same area. And then we look at the estrogen dominance, and it's almost equal to the progesterone. And when we go to menopause, it looks like a flat line. There's nothing. So this is another cute little cartoon showing the menopause, premenopause, and you thought you were in menopause and now you're pregnant. So what if it's a surgical approach? When we look at the advances over the last 20 years in minimally invasive surgical approaches, we look at minimally invasive surgical approaches providing a number of advantages to the patients compared to the traditional abdominal procedures. Women are able to recover quicker, allowing for a quicker return to work and daily activities, shorter hospital stays, less pain and scarring, and a lower chance of infection. The recovery period includes, on average, 3 to 4 weeks from a minimally invasive approach, as opposed to 4 to 6 weeks on average from an abdominal approach. When we look at the advances towards less invasive surgery, as you see here to the left, the abdominal incision is almost like a C-section scar. Then we have the laparoscopic, where small incisions are made and the physician is right there at the patient's bedside. And then we have the robotic assisted, where the surgeon is in a console and we have multiple ports. With the Da Vinci surgery, the robotic surgery, over 2 million procedures worldwide. Why is this an important procedure? Well, when we look at the camera itself, it's a high definition 3D vision. And the surgeon controls this camera from the console. And it's up to 10 times the zoom. When we look at precision and dexterity, unlike the traditional laparoscopy, the instruments, once they're inside the patient's surgical field, it mimics the surgeon's hands. So there's no twitching, tremors, or any of that, and the instruments move at a 360 degree. And then you have the advanced software, which gives you the ability to control very fine movements. What are some of the potential patient benefits versus looking at an open surgery? Fewer complications, minimal scarring, as you can see here to the right. We have versus open and traditional laparoscopic surgery. We have with the robotic surgery less blood loss, shorter hospital stay. And when we're looking at shorter hospital stay, when you're looking at an open, patients are in the hospital approximately 4 days, where with a Da Vinci surgery, it's an outpatient to 24-hour hospital stay. And then when we look at traditional laparoscopic surgery versus robotic surgery, we have a fewer conversion rate to open. And what that means is when you initiate the surgery laparoscopically or robotically, you don't end up, as they say, giving up and having to do an abdominal incision due to the difficulty of the surgery. And the biggest and most important thing in my mind is less need for narcotic pain medication. And that's an important thing to look at in this day and time, is the amount of narcotic use and pain medication that's used during surgery. And that's one of the advantages of robotic: less pain, less nerve damage. Thank you for taking the time to listen to this presentation. And for an appointment, please don't hesitate to call my office for an appointment. Thank you.